Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon, everyone. I just had uh, a phone call with one of my colleagues, and he was telling me about his problem with an anxiety, especially before the exams. And I thought it's very important to share with you his symptoms and how we went through the phone call. We talked about all the symptoms and how I explained to him why he has all these symptoms and what should we do to fix all these problems. I think it's important to share with you guys, with everyone, so that if you have any kind of these symptoms, if you're facing any problems like the one he's facing, it's good for you to know it and think about it and consider maybe uh, you know stopping for a while and seeking some help. Before we start, I just want to make sure that you can hear me and my voice is clear. Also, if you have any questions or any comment, I'm happy. Please just put it in the comment, and I'm happy to answer as soon as I can. I think I'm sharing live now, so just double checking if there's anyone on the chat, and we'll take it from there, inshallah. All right, good. So we have a good voice. Thanks, Sir. Okay, so without going into his details, he's a pediatrician. He's living in Egypt, and he called me mainly because he's having problem with an anxiety, especially before and during exams. He's telling me that he just had an exam recently. He had what looks like almost a panic attack before the exam, and during the exam, it was an oral exam, and he couldn't finish the exam, I believe, or he had a very hard time finishing the exam. And he told me that he's been complaining of this anxiety for too long, but it's been getting worse and increasing in numbers and frequency lately. Right now, when we talked a little bit further, and he started telling me that it's not only about the anxiety. He told me that he's also having problems in focusing during studying, having problems in restoring all the basic information that he knows already, having problem in his short memory. He told me also that he's having problems dealing with his friends, his colleagues, his family. He's becoming very emotional, very aggressive. He told me he's having this kind of anger tantrums or anger episodes. He becomes very angry for very simple things, and he's not like that. He's not like that. Now, when we went further into the call, he started telling me that he had problems in his childhood, and this is something very common with everyone who calls me about depression or anxiety or burnout. He had problems in his childhood. He's been having lots of stress in his college, which is something also very common for all of us doctors or nurses, especially in his exams. But he told me something that's very important. He told me that he don't remember, he doesn't recall any positive or any happy moment in his life. He doesn't recall any happy moment in his life. He believes that all his life has been about stress, about negativity, having hard times. He can't remember any happy moment in his life, which is something very unique in chronic stress and burnout. And I will tell you why. Now, when we summarize the symptoms that he's having, all of his symptoms can be explained because his brain is facing chronic stress for too long. If this stress is mainly in work, we can call it burnout. But I want you also to think about burnout as burnout in your work, burnout in your life, burnout at home. So it's not only just burnout in the work. Now, when the brain is facing lots of stresses, lots of problems, threats, as I call it, the brain has to react. The brain has to defend itself. Now, what happens basically, and I don't want to go into details today, I just want to summarize things. And this is exactly what I told him, yeah? What happens is basically his amygdala becomes hyperactive, becomes hypertrophied. And when it becomes hyperactive and hypertrophied, it affects a very important part of the brain, which is the prefrontal cortex, the PFC. And once the PFC is affected, you lose all the brakes and all the control in the amygdala. So the PFC is the control and the brakes for the amygdala. So once the PFC is affected, becomes atrophic, doesn't function well, the amygdala continues firing without any brakes. And here comes the main problem. The amygdala is responsible for stimulating the hypothalamus, causing the rush or the gush of the adrenaline and noradrenaline in our system. And that's why he's having all these anxiety attacks, or let's call it panic attacks. His heart rate goes up, it's racing. He told me he cannot control his heart rate. He even mentioned it goes up to like 300 beats per minute. His breathing is so fast. He's sweating. All this because of his noradrenaline and adrenaline gush in the blood. So the amygdala now doesn't have any break. So it continues firing and stimulating the hypothalamus and secreting noradrenaline and adrenaline the whole time. So that's number one. That's why he has anxiety attacks and panic attacks, because his amygdala is totally uncontrolled. Now, the other thing is his loss of focus, his loss of concentration, his problems with his memory, his problems with his studying, with recalling of his studying. All of this are because his hippocampus, his caudate nucleus are affected. And this is also because of the chronic stress that he's having. Now, what else I explained to him is his negativity. How is he seeing the life as negative? He can't see any positive events. He can't remember or recall any positive events or any happy events in his life, which is true. The problem is that your brain, you want to call it your unconscious mind, your subconscious mind, whatever you want to call it, because of all these events, all these bad events, the stresses that he had in his life, all these events precipitate negative. I call it negative charges in your brain. Negative, call it negative charges or negative events in your unconscious mind. Now, the unconscious mind is the projector for your life. And because you have too much negative events and too many negative charges in your unconscious mind, it projects your life as negative event. Your perspective to your whole life becomes negative. You cannot see positive things in your life. You cannot see the positive side in your life. It's as if you're wearing glasses of negativity. You're just seeing negative things in your life. And that explains why he can't remember or recall any happy moments or any positive things in his life, because he couldn't see them. He couldn't see them. He just only sees the negative things. And think about it. It's because you're seeing all these negative things in your life. All these negative things translates back to your brain as threats, as stress. And of course, because of that, your brain will start again reacting and defending, and you go into a vicious circle. So we need to solve this problem. We need to fix all these things. We need to fix the problems in the brain, the centers of the brain that have changed, how you're seeing your life as negative things. So this is what I told him, and I think it's very important for everyone to understand that. As hard as it seems, that people are having an anxiety, even mild depression, burnout, problems with sleeping, problems with focusing, all these problems. As hard as it seems, it's very simple to fix. It is very simple to fix. All what you need to do is break the vicious circle. Reset your brain. All what you need to do is restore the centers in the brain that are affected. But you cannot work on the centers individually. You cannot work on each center by itself. It doesn't work like that. All you have to do is stop sending threats, negative things. I call it negative messages to your brain. How can we do that? All right. Before I tell you how can we do that, if you have any questions or comments, I'm happy to answer. Your opinion. Thank you so much. Thanks for that. Your opinion. If you have any question or comments, I'm happy to answer. I hope you're enjoying the video, and please subscribe. If you are on the YouTube, please subscribe to the YouTube channel, because from now on I'll be doing lots of live videos so that you don't miss any videos. Let me check also if there's anyone on the Facebook. All right, Ahmed Gamal. Thanks, Ahmed. Thanks so much. If you have any questions or comment, please let me know. All right. So now we are done with the symptoms. We are done with what have changed in the brain. Now, how can we fix that? Number one, the first thing we have to do is we have to stop the amygdala. We have to control the amygdala. The amygdala is the main problem here. It's the start of the problem. The amygdala is hypertrophied. It's firing signals the whole time, firing signals to hypothalamus, firing signals to control or to inhibit the prefrontal cortex. The amygdala is a big, big problem. And there's no brakes. You've lost the brakes for the amygdala. So you have to control the amygdala. And there are too many ways that we can do that. But you have to learn these ways. You have to learn these tools and techniques and skills to control the amygdala. There are lots of skills and techniques and exercises that you can learn and do, becomes a part of your life, a regular practice in your life. And instead of the prefrontal cortex, something that you can do every now and then to control the amygdala. And this is very important. So this is number one. Without that, we cannot cut the vicious circle. The second thing, we have to restore the connectivity between the prefrontal cortex and the amygdala. And how can we do that? How can we restore the control of the prefrontal cortex on the amygdala? There are lots of studies have been published regarding this issue. Many things, including meditation, CBT, hypnosis, specific kind of exercises. All these things affect many things in the brain or in the body, mainly in the brain, that can control this connectivity, including affecting your brain waves, changing your brain waves, changing your sympathetic and parasympathetic control, changing what we call the heart rate variability. There are too many studies have been published. So there are too many ways that we need to learn on how to restore the connectivity between the prefrontal cortex and the amygdala, so that the prefrontal cortex becomes again the natural brake of the amygdala. Now, this is the second thing. The third thing, which I think is very important, is we need to change our projection, our projector, our perspective of life. We need to stop seeing only negative things in life. We have to start seeing positive aspects of life. We cannot do that unless we get rid of most of the negativity sitting inside our brain. All these negative charges that have been precipitated in our brain, in our unconscious mind, has to be gone. You have to let it go. And instead of having negative charges in your unconscious mind, you start adding positive charges in your unconscious mind. By this way, you start seeing life in a different way. You start seeing aspects of life that you haven't seen before. Positive things in your life. By seeing positive things in your life, you start sending positive messages to your brain. And this cuts the circles, cuts the vicious circle. Once you see positive things in your life, positive messages come to your brain starts to ease down, stopping the defensive mechanisms. You restore the safety mode of your brain. There's too many ways of naming it. But this is how we do it. You have to restore the safety mode of your brain. And by that's the only way you start restoring again all these centers. Hypothalamus becomes back again to its normal size, PFC, caudate nucleus, hippocampus, and lots of other centers. You restore back your sleeping pattern. You restore back your parasympathetic drive. You have changes in your brain frequencies. Everything changes. The levels of noradrenaline and adrenaline starts to come down by restoring the safety mode of your brain. That's how we do it. And you expect these changes to happen slowly, but gradually, slowly and gradually. It will happen. Once you start cutting and breaking these vicious circles, all these changes will happen again. And this is confirmed. This is what we call neuroplasticity, or the plasticity of the brain. The neuroscience has proven that all the changes in the brain are either fully reversible or partially reversible, but they are mostly reversible. So if you start stopping the vicious circle, because nothing will change unless your brain moves from this dangerous mode or stress mode to the safety mode. Once the brain moves to the safety mode, all these changes in the center starts again, and the reversibility starts, and everything comes back to normal, and you start living a normal life again, where your brain is under control, your emotions are under control, your centers are performing well, and back to normal. So as I told you, as hard as it seems, the solution is there, and it can be implemented very easily. You just have to learn a few things, few tools, few techniques. You have to do some exercises. You have to let go of negativity inside your brain. Of course, you need some help with these things, but it's easy to be done. And I have to tell you that through the last 2 years, or even more than 2 years, I've been helping too many doctors and nurses to let go and control their burnout syndrome, their depression, their anxiety. And by implementing this plan, it has been very successful. Most of them, within a month, most of the symptoms has been reversed. So this is how you manage your anxiety, your burnout, your chronic stress, even the mild and moderate depression. This is how you reverse things. I'm done. This was my phone call with our colleague. If you have any problems like that, if you have symptoms and complaining of the same things that our colleague had, don't ignore them. Don't ignore them. You have to stop and ask yourself, where are these symptoms heading? Where are you going? Because remember, as I told you, they are reversible. All these changes are reversible. However, if you continue doing that for a very long time, it's very hard to reverse them back again to normal. It takes longer, it becomes hard, sometimes becomes partially reversible, as I said. And never wait until you fall or you start having symptoms of depression. Never wait. This is bad. All right, guys. Is meditation helpful? Yes, meditation is helpful to some point. You have to know what are you doing with the meditation, what are you aiming for. It has to be done in a specific way. But yes, meditation, mindfulness exercises, all these things are helpful. But as I told you, it's not only about one thing, it's about doing many things. So you have to, as I told you, you have to cut the vicious circle in many points. Stopping the amygdala, letting go of your negative uh, precipitates in your brain, reconnectivity or establishing the reconnectivity again or the connectivity between the prefrontal cortex and the amygdala. So there are too many things to do. Part of it, yes, meditation is very important. Physical exercises like training, like running, swimming is very important also for part of this. But yes, meditation is definitely important. If you have any questions, please let me know. I wish that this live video has been useful. I'm planning to do more of live videos if you like it. So please like the video, maybe share and comment, subscribe to the channel. And I'll see you soon. If you have any questions, just leave it in the comment and I may answer your question in the next video. Thank you so much and have a good one. See you.